Is Jennifer Kalinsky here and Heather Endicott, and we're here, Curology, both Facebook Live and Instagram Live, because that's how we like to roll. And here today we are going to talk to you guys actually about big zits. We have a great new big zit guide up. We have a lot of guides now actually, which is really cool. So we have this like wealth of information on our website. If you guys go, even just Google Curology guides and it totally comes up. You'll see them all. One of them is about our big zits, which is what we want to talk to you about today. Why do you get these big zits? What are they? What can you do about them? How not to pop them. But if you must, we will give you some tips there. But we don't want them to pop it.
Don't pop.
Yeah, don't
Please.
pop. Don't do it. So our guide, this guide is really beautiful. I'm like looking at it right now because I just think it's so cool. It's so well done. It's visually appealing. I want you to go check it out. And really our first message is those zits that come up that are big and juicy and you're like, oh, I just have to do it. I have to pop it. Don't pop it. Okay. We're going to give you some tips there that are much better. Popping leads to scarring.
It really does.
You know, you can spread the acne. It's just bad. So try not to do that. You know, because really when you pop it, all that stuff that comes out is going on into the rest of your pores. And, you know, Heather was just sharing a really bad story with me earlier about, you know, really some things that she's seen that can happen. You know, you can get these really bad infections. So definitely that's our big message here this morning. Don't pop it. Now, what do we like to tell people to do instead of popping that big juicy zit?
This is my specialty area. Despite my best efforts, when I get extremely stressed or possibly eat a lot of sugar, which happened last weekend, I actually will get a large cyst, which I happen to have on my face right now, but I have covered. I'll come a little closer and show you.
And see, you can't even really tell. I love it.
Here.
See, she's wearing a little, well, I'm going to let you tell them.
Yeah, a little hydrocolloid, cover. And what they are originally
besides
were,
like miracle workers.
Besides miracle workers. Like, I don't leave my house without them. I love them so much. They go on trips with me. Pretty sure if I was on a deserted island, I would still have them with me.
You are like the poster child. I love it. And she came in this morning wearing one. She's like, I'm just going to keep this on.
This isn't special for you guys. This is me. So what I love about these is when you apply them, they actually pull out the pus, pull out the moisture, take away the inflammation and redness at exceptionally fast rate. And what we recommend is applying them for 12 probably the 24 hours. I have used them even up to 48 hours, which you can actually do. And there's many reasons you do it. First, it makes you stop picking. Yeah. You're not so self-conscious. It actually lessens the discomfort because it takes the swelling out.
And you feel like you're doing something.
You are
like proactive, like I am handling the situation.
It is a bunch of fairy magic. It works so well. That's how much I love it. I put this on last night. It was big and red and painful. And I put it on mostly for the pain at this point because it wasn't a pus head yet. Let's just call that what it is, pus head. Gooey pus heads.
Love it.
And I've kept it on overnight. I slept in it. It stays on really well. I have very sensitive skin. I can just itch my skin and I'll get a little rash. These have not caused a rash in me at all. I've kept it on overnight. I had a little one on my chin because I ate a lot of sugar last weekend, like every day, a lot of kettle corn. I put that one overnight. It pulled out all the pus. And what happens, I don't know if you can see these cute
different
little
sizes,
round,
right?
For depending on what, far enough, close enough. When you have a lot of pus in your cyst and it's gooey, this will actually pull out the moisture and it'll get a little white in the center of these, showing you where it has pulled out the pus, which is very rewarding for those of us that want to pick so badly.
You feel
so we see it's working. It's working.
And you're not going to get scarring.
Yes.
You're not going to get these bad infections that can come from popping.
Which I have seen in my patients in the past, in my in-person practice. We actually had a 17, 18-year-old girl who popped and picked, and she self-inoculated with staph. So what started off with a simple cyst that would have healed in about 72 hours now became a staph infection that reached along the face, which tragically happens more than you think when people are popping their own zits.
Right. And
now,
it is really hard to
really
not
hard.
go for it, though. Every time you pass a mirror, you see it. You're outside, you see people looking at it. Even if they're not looking at it, you think they're looking at it.
Yeah.
So these are a great way just to pop one on in the morning, forget about it, go. They're sold under a lot of different brand names. Sometimes they're hard to find too. In our guide, we kind of give you, if you go online and search our guide, you'll see the different brand names and some where you can find them. But pretty much Target, the pharmacies, Walmart, everywhere. They sell them under kind of different names, but they're there. If you can't find them, ask the pharmacist. The pharmacist usually knows how to find them in the pharmacy aisles for you. Okay?
They're very much so hidden in the Band-Aid section. And I, knowing what I have to look for, still have to look for.
I do too. Every time I go to buy them, I'm like, where are these things?
them?
But I trust they're there. So just ask the pharmacist. They're going to help you find them.
Or like me, just Amazon Prime it. It'll be there in 2 days. On my doorstep, instant
That's right.
gratification.
Amazon Prime. We love Amazon Prime. Laura and I always talk about Amazon Prime. So these definitely we recommend. Now, when would you use these though? Now, if you have a white head, you have a black head. I mean, these really aren't, we're talking about, and this will segue into the differences that you can find in different zits, pimples. We have our inflammatory lesions, we have our non-inflammatory lesions. So the non-inflammatory ones are really your white heads and your black heads. These aren't really for that. No. There's other things for that we'll discuss another time. These are really for those inflammatory lesions, the pustules, the cysts, that usually, are red, they're puffy, painful. They sometimes get a nice little, that juicy like whitehead on there, that part that you want to
just want to pop. See, you can tell I've had these.
This is where, I can tell. This is where you put these on and forget about it. Change them out in 24 hours and then go on with your life. But now, let's just say, and I'm just going to, let's just say that you're like, okay, you know what, I've got to, I don't care what they say, I heard Heather, I heard Jen, I'm not putting the hydrocolloid on today, I am picking this baby. Okay, well, besides saying, please don't do it, after that prefacing, we will say, to do it, you have to be very cautious and careful about it. So you're going to want to take all those measures to make sure your hands are clean, to make sure what you're using to pop it is clean, and not just clean, but sterile. So your hands you want to really scrub up. You want to use a little bit of, you want to get whatever you're going to use, a lancet if you have it, but who's got a lot of lancets sitting around unless you're like medical people.
What's a lancet?
So, it's like a surgical tool. Basically, get out your surgical kit, and I think that you will then find your lancets in there. But besides that, get a sewing needle or a pin, use a lighter to really sterilize it, and then you can use it. But before you do that, you're going to want to be really gentle, because you're going to want to do it, and our zit guide tells you really well how to do this, but you're going to want to just gently pop the center of it, and then with like a cotton swab, not even clean hands, but with a cotton swab, you're just going to want to like gently coax the contents out. If the contents do not gently come out, do not force it. This is where scarring and everything else begins. You do not want to do that. So if you can do it gently, and get some of that out, then pop a hydrocolloid on it, and now really forget about it. But what is that generally how you advise?
That's generally how I advise. I would hope that when we say, pick up a needle or a pin and poke it in your skin, that would stop you, because it does sound dreadful.
But it doesn't.
It doesn't.
We know it doesn't.
So what I really say is, if you're going to do it, please make sure it's really juicy. I think a lot of people want to do is when it's still kind of hard and underneath your skin, you want to dig it and find it.
No digging.
That's where I see a lot of correlation with scarring. Really wait till it's so juicy that it almost is coming out on its own.
Yeah, exactly.
That's where I draw the line.
Right. If not, hydrocolloid. Well, hydrocolloid anyway.
The whole time.
But there you go.
Yeah.
So, really what it's about is, if we can impress on you again, hydrocolloids are fairy magic.
Fairy
kind
magic.
Of loving that.
With a little bit of glitter thrown in, like magical.
So remember that. If you want some fairy magic in your life, you need to get some hydrocolloids. Just don't pick anyway, buy them. And, check out our guides. We have so many guides now that are just like very aesthetically pleasing and a wealth of information. Go online, just Google Curology guides. They're going to pop right up for you. You can find them on our website if you go down to the bottom and click on help anyway, but pull them up, look through them. We have so much great information for you guys. So I hope you go check it out, and I hope you join us next week for Facebook Live. We will be exploring many topics over the coming months that I think you're going to find both fascinating and enlightening. So please join us then.